A looming shadow, the alarming rise of HIV in Western Visayas. The Philippines is grappling with a silent crisis. The Department of Health paints a stark picture. New HIV infections have skyrocketed by 119% from 2010 to 2020. This alarming trend is particularly pronounced in Western Visayas. The region has become an epicenter of the epidemic, demanding immediate attention and comprehensive action. The statistics are not just numbers. They represent real lives impacted by this devastating disease. Western Visayas, known for its vibrant culture and economic dynamism, now faces a formidable challenge. The region has witnessed a steady increase in HIV infections over the past decade. Urban centers and rural areas alike are feeling the impact, highlighting the widespread nature of the epidemic. Factors fueling this surge are complex and multifaceted, ranging from limited awareness and access to healthcare to social stigma and discrimination. The DOH report reveals a worrying trend among key populations. Men who have sex with men, MSM, account for a significant portion of new infections. This underscores the urgent need for targeted interventions and support systems tailored to their specific needs. Additionally, people who inject drugs, PWID, also face heightened vulnerability, highlighting the intersection of HIV with other health issues. Addressing these interconnected challenges is crucial to curbing the epidemic's trajectory. The alarming statistics serve as a wake-up call. The escalating HIV crisis in Western Visayas demands a multi-sectoral response. Government agencies, healthcare providers, civil society organizations, and communities must unite in a concerted effort. Ignoring the problem will only exacerbate its consequences, jeopardizing the health and well-being of individuals and undermining the region's social and economic progress. The time to act is now. Uneven battlegrounds, provincial disparities in the epidemic. Within Western Visayas, the HIV epidemic manifests differently across its provinces. Iloilo, the regional center, bears a disproportionate burden. Its dense population and bustling urban environment create unique challenges for HIV prevention and control. Negros Occidental, known for its vast sugarcane plantations, faces its own set of vulnerabilities. Limited access to healthcare services and socioeconomic disparities contribute to the spread of the virus. Antique, a province renowned for its natural beauty, grapples with a different set of issues. The stigma surrounding HIV often prevents individuals from seeking testing and treatment. This fear and silence create barriers to effective prevention and care. Aklan, home to the world-famous Boracay Island, witnesses a different dynamic. The influx of tourists and transient populations adds complexity to HIV prevention efforts. These provincial disparities highlight the need for context-specific interventions. A one-size-fits-all approach is insufficient to address the unique challenges faced by each area. Tailored strategies that consider local demographics, socioeconomic factors, and cultural norms are essential. Collaboration between provincial health authorities, local organizations, and community leaders is paramount to ensure effective program implementation. Understanding these provincial nuances is crucial for developing targeted interventions. Resource allocation should prioritize areas with higher infection rates and greater vulnerability. Moreover, addressing the social determinants of health, such as poverty, lack of education, and discrimination, is essential to creating an environment conducive to HIV prevention and treatment. By recognizing and responding to these disparities, Western Visayas can mount a more effective response to the epidemic. Beyond numbers, faces, and stories of the silent crisis, behind the alarming statistics are real people whose lives have been irrevocably altered by HIV. Their stories humanize the epidemic, reminding us that this is not just a public health crisis, but a deeply personal one. Take, for instance, the story of Maria, a young woman from Iloilo City. Diagnosed with HIV at the age of 24, she faced discrimination from her family and community. Forced to drop out of college and ostracized by friends, she found solace in a local support group. Carlos, a 32-year-old gay man from Bacolod City, Negros Occidental, shares a different struggle. He contracted HIV from his long-term partner, who was unaware of his status. The experience shattered their relationship and left Carlos feeling betrayed and alone. He struggled to access antiretroviral therapy, ART, due to financial constraints and fear of judgment from healthcare providers. His story highlights the urgent need for accessible and stigma-free HIV services. These stories are not isolated incidents. They represent the countless individuals in Western Visayas living with the physical, emotional, and social ramifications of HIV. Many face stigma and discrimination, making it difficult to disclose their status and access the care they need. The fear of judgment and rejection prevents them from seeking testing, treatment, and support, further fueling the cycle of transmission. It is imperative to remember that behind every statistic is a human being deserving of compassion, respect, and access to quality healthcare. Their stories underscore the importance of addressing the social determinants of health, promoting HIV awareness, and fostering an environment of acceptance and support. Only then can Western Visayas effectively combat the stigma surrounding HIV and ensure that those affected can live with dignity and hope. Section 4. A call to action combating HIV in Western Visayas. The escalating HIV crisis in Western Visayas demands a multifaceted and urgent response. Addressing this complex issue requires a concerted effort from all stakeholders, including government agencies, healthcare providers, civil society organizations, and communities themselves. A comprehensive approach that encompasses prevention, testing, treatment, and support is crucial to curbing the epidemic's trajectory. Strengthening HIV prevention programs is paramount. This includes scaling up comprehensive sexuality education in schools and communities, promoting condom use, and expanding access to pre-exposure prophylaxis, or PrEP, for individuals at high risk of infection. Targeted interventions for key populations, such as men who have sex with men and people who inject drugs, are essential, as is addressing the social determinants of health that increase vulnerability to HIV. Expanding access to HIV testing is another critical component of the response. This involves promoting voluntary counseling and testing services, making testing more widely available in healthcare facilities and community settings, and introducing innovative testing approaches, such as self-testing. Early diagnosis is vital for timely initiation of treatment and prevention of further transmission. Ensuring access to quality HIV care and treatment is non-negotiable. This includes providing free or low-cost antiretroviral therapy, strengthening healthcare infrastructure to accommodate the growing number of people living with HIV, and training healthcare providers on the latest HIV treatment guidelines. Adherence to ART is crucial not only for individual health outcomes, but also for reducing HIV transmission rates within communities. Section 5. The unfinished fight: sustaining efforts for a healthier future. Combating the HIV epidemic in Western Visayas is not a one-time endeavor, but an ongoing commitment. Sustaining efforts over the long term requires addressing the root causes of the epidemic, fostering community engagement, and ensuring the availability of resources. Continuous monitoring and evaluation of programs are essential to assess their effectiveness and make necessary adjustments. Addressing the social determinants of health is crucial for achieving sustainable impact. This includes tackling poverty, improving access to education, promoting gender equality, and combating stigma and discrimination. By creating a more equitable and just society, Western Visayas can reduce vulnerability to HIV and improve overall health outcomes. Community engagement is paramount to the success of any HIV program. Empowering communities to take ownership of their health, participate in program design and implementation, and advocate for their needs is essential. Building strong partnerships between government, civil society, and communities fosters trust and strengthens the response. Finally, sustaining efforts requires a sustained commitment to funding and resources. This includes allocating adequate budgets for HIV prevention, testing, treatment, and care programs, as well as supporting research and innovation in HIV prevention and treatment strategies. Investing in the fight against HIV is an investment in the health and future of Western Visayas.